Support for Radio Friends comes from Columbia Healthy Smiles, the dental office of husband and wife team Dr. Batson and Dr. Abe, offering comprehensive and customized care to patients of all ages. Learn more by calling 573-721-9039 or online at www.columbiahealthysmiles.com. Good morning and welcome to Radio Friends on Wednesday, January the 26th. I want to introduce you to a person making his first appearance on Radio Friends today. That is Brett Chamberlain. Good to have you here, Brett. And you are from Burrell Behavioral Health.
That's exactly right, Paul.
You specialize in adolescents.
Yes, child and adolescent. So I see young kids all the way down to age 4 and then up to about 17 years old. And then by the time they become 18 and turn an adult, I move them onto an adult psychiatrist.
How big of a problem is mental disorder among young people?
It's quite a large problem. Some of the recent statistics from CDC have shown that maybe 1 out of every 3 young individuals suffers from some type of mental health.
1 in 3?
Something like that. Yeah, it's around that. And that's at some point during their childhood or adolescence, they may suffer from some kind of mental
So what's
health.
the youngest age that you have dealt with?
The youngest that I have personally dealt with is 4 years old.
Okay. Now, how do you know? How can you tell that a 4-year-old is having a mental health problem?
That's an excellent question. It's not easy to tell. That's part of why I go through so much training and education.
Yeah, because 4-year-olds are going to throw temper tantrums.
Sure.
They're going to cry if they don't get their way.
Absolutely.
Well, how do you know if this is normal or if this is a problem?
Yeah, that's a great question. Most of the time it has to do with the experiences that those young individuals have had. So the vast majority of the time when I'm dealing with somebody 4 or 5 years old, most of the time it is because they have experienced some sort of significant trauma in their life. They've had a major disruption. They're no longer living with their biological parents, maybe in the foster care system, and those sorts of things.
So what can parents or adolescents do, or the community do, to reduce chances of mental health problems with kids?
That's a great question. So, this is something that I'm very passionate about is preventative work, and something that I try to counsel my patients on all the time. I think, unfortunately, we're so often told that mental health disorders are a medical illness. There's nothing you can do to change it, and so you need to go and get help. And while it's true that it's good to go get help, there are things that you can do to lower the chances that you're going to suffer from a mental health disorder and to maybe get better from mild mental health disorders all on your own. And the 4 areas that I primarily counsel my patients on are diet, sleep, exercise, and socialization. And so I have a little spiel that I go into on each one of those things. So diet's probably the easiest one to talk about. Most people understand what a relatively healthy diet looks like. Eat lots of vegetables, eat lots of whole, real foods, stay away from excess sugar or processed foods. And this is not as much of a problem in the child and adolescent population.
Wait, let me stop you a minute here.
Yeah.
Why are you saying, we know excess sugar and processed foods is not good for our body.
Sure.
But what does that have to do with our mental health?
Well, our physical health and our mental health are one. They're not quite as separated as we once thought they were. You and I probably have recognized as we've gotten older that after pizza night, we don't feel as good the next day. And it's not just that we don't feel as physically well, but we're sluggish. We don't think as quickly. We might not deal with stress as well as we once did. And so we know that your physical health and your mental health are intimately tied together. Mm-hmm. And so taking good care of our bodies helps to take good care of our minds.
And then exercise, of course, you reduce those endorphins. You release those endorphins.
Exactly.
It's kind of like a natural high.
You're exactly right. In fact, there was a research study that compared Prozac to physical exercise, looking at which was a better antidepressant. And what they found in that particular research study was there was no difference, that Prozac was as good of an antidepressant as I think it was 3 or 4 times a week of 30 minutes a day of exercise.
Yeah, and it doesn't have to be really strenuous exercise.
You're exactly right.
Just getting outside and walking, getting out in the environment makes a difference too.
Yes, there's lots of studies on exposure to nature, exposure to sunlight and fresh air, and how much those things can make a difference in your overall mental health.
The sunlight, because a lot of people, not just kids, but a lot of adults, suffer from seasonal adjusted disorder?
Seasonal affective disorder.
Seasonal affective disorder.
Absolutely.
And that's by not getting enough sunlight affects your mood and personality.
Yeah, you can. So during the winter months, we have a lot of individuals who become vitamin D deficient. We get the majority of our vitamin D from sunlight, and that can affect if it gets low enough, it can affect your mood.
Mm-hmm. What would you say is the biggest mistake that parents would make with their kids if they feel that they are having some types of mental problems?
I definitely think the biggest mistake that I see parents and families and communities make when it comes to young individuals suffering from mental health disorders is not taking those concerns seriously. Definitely a few generations back, we had this attitude of, grit your teeth and get over it, or move past those things. And I think there is some value in individual resilience, and we should foster that in young people. But that's not the same as ignoring somebody's mental health concerns and letting those things fester for long periods of time.
Okay, let's turn to teenagers. We got about 2 minutes left here. Teenagers can be rebellious.
Absolutely.
And that is a part of being a teenager.
Yeah.
You know it all.
Yep.
Mom and dad don't know anything.
Yep.
They're dumb.
Yeah.
We've gone through that. When do you know, when does mom and dad or aunt or uncle or grandma or grandpa say, hey, wait a minute, this is beyond the normal part of being a teenager? My teenager's got a problem.
Yeah. Well, I think this applies to all aspects of mental health. Is when do we draw that line between normal human experience and mental illness? We all feel anxious sometimes, but when do we have an anxiety disorder? We all feel sad sometimes, but when are we suffering from depression? We all go through a rebellious, maybe not all of us, but a lot of us go through a rebellious period. When does that become some sort of disorder? And the line that we draw in mental health is in your functionality. When your problems are so bad that you are no longer functioning like you once were, either in your relationships or your schooling or with your family members, that's usually the tipping point for us to say, maybe it's time to get some help and get some treatment.
Okay. When they're not functioning the way they normally would.
Exactly.
But you can have highs and lows, too.
Sure, absolutely.
And that's normal.
Yes, that's absolutely true. And so that's also part of my job is, yes, sometimes my job is diagnosing and treating mental health disorders, but also some of my job is educating that some of these things are part of the normal process of life.
Can you say, we're almost out of time here, but do you say most people can be treated by just talking to them, or do the majority of people need some type of medication?
I'd say the majority of people will respond to mild interventions, some lifestyle changes like the 4 things we talked about, especially probably for adolescents, the last one, which is socialization, meaning in-person socialization, getting away from social media, getting away from your smartphone, spending time with real friends and family.
Okay, and that has been difficult during this pandemic.
You're absolutely
correct. Has been difficult. So hopefully it will get better.
Yes, I sure hope so.
If people want more information, how do they get in touch with you?
Sure. So they can go to burrellcenter.com, or they can call 573-777-8300.
Okay, or www.burrellcenter.com.
Yep.
Thank you so much for coming by. All right.